So tonight we're going to be talking about viral pandemic facts, strategies, and choices. You have choices. Don't let anyone tell you otherwise. Freedom from fear. So if you take a look at this first slide here, you'll see what looks like, maybe a virus? Which could certainly inspire a lot of people to fear at this point. It's actually not a virus, and you'll learn that as we go through the presentation. So tonight, by the end of the presentation, we're hoping that you understand the difference between pandemic cases versus fatalities, the fact that testing is simple, or maybe not, what is actually going on with lockdowns, masks, and most importantly, if you don't take anything else away, I want you to take away this last point. Prevention and early intervention is safe, it's effective, it's inexpensive, and here's the really crazy part, it's even over the counter. How many of you have been told that? You probably haven't. And the reality of every single portion of this is 2 Timothy 1:7. For, I did not give you a spirit of fear, but of power, of love, and a sound mind. So anytime anything comes your direction, the first thing to do is immediately stop, go back to 2 Timothy 1:7, power, love, sound mind, go straight up to the Lord and say, show me your perspective on this. What do you say about this, Lord? Right now we're in an environment where everything is spinning and it's moving so fast, and it's designed to create confusion. It's designed to create anxiety, depression, fear. That doesn't come from the Lord. Okay? Stop. And anytime you start getting that feeling, that is a warning sign to immediately do exactly the opposite. Go to a position of power, love, sound mind. Slow it down. Reject the lie. So to start with, what is a pandemic or an epidemic? Epidemic is typically restricted to one country. Pandemic is typically across the entire world. Now, the part that's really interesting is the World Health Organization, up until May 4th of 2009, had an interesting definition of a pandemic that then changed. And that change actually has gone more to what the German disease experts are now currently saying. That's a long-lasting international situation involving substantial loss and causing such lasting damage as to jeopardize or destroy the livelihood of large numbers of people. I'd say that's exactly what we're experiencing at the moment. What's interesting is in 2009, epidemiologist McKenzie proposed taking the severity of the disease into account with the definition. That was rejected. What happened? Special interests with strong connections encouraged that a pandemic would be declared as quickly as possible. Start thinking about the things this way. Start looking at things from a little different angle. The question is, who is the special interest, and why would they want a quick call for a pandemic? Now, that is not the focus of the topic of this conversation, but as you watch stuff start coming down through the news cycles and everything else, look behind the scenes. Look behind the curtain. Follow the money. What's the incentive? The print on this is going to be a little small for you to see, but here's the major thing. This is from the World Health Organization, and this is the piece that I want you to see. Overall, the infection fatality rate at 51 locations across the world was 0.23%. Do you realize that's 2 out of 1,000 people? This is from the World Health Organization. Their data is supposed to be the best there is, right? 2 out of 1,000, okay? For those that were under the age of 70, it was 0.05%, or 5 out of 10,000 people. Just out of curiosity, I looked at the CDC flu, influenza, typical season numbers for 2017 going into 2018. At the peak of the flu season, they said that 10% for a period of 4 weeks was the death rate. Do you realize how much higher that is than this, what we're looking at right here? And yet we're shut down economically. Something's not passing the common sense test. These slides here, next couple of slides I'm going to go through, are put together by Ivor Cummins, who is a brilliant statistician. And he actually did a look at Ireland and UK by the numbers. And so I'll give you an idea of what you're looking at here. And if you want to learn more about Ivor's work, this came from a presentation that was featured by Pandemic Town Hall. That is pandemictownhall.com. Encourage you to go there. This is just one of 3 fantastic presentations. They're doing a great job on getting the truth out, and I'm very, very blessed to be able to learn from those great people and be a part of that group. The increased testing, there's a lot of PCR false positives. So on the top there, what you're looking at is cases. At the bottom, what you're looking at is the actual deaths. And you can see there that cases went pretty high, deaths hit their curve, and we call that a Gompertz curve, and that's a typical Gompertz curve. And then you'll see that things really minimize throughout the summer, okay? And then at the end of the summer, you'll see that cases are starting to rise again. But where are the deaths? Do you see a death rate there? And this is all strictly statistically speaking based upon the numbers that are being reported. This is not an opinion. This is just data. You look at the UK, see a similar pattern. Okay, well, that's across the ocean. Maybe the United States is super different. Okay, this is Spain. And there's a reason why he used Spain here, and that is the fact that you'll see that, again, cases are rising really high. You'll see that they actually are getting a little bit of a climb in their death rate, and it's a result of their climate. This would be normal for that climate. So with that, here's the real key to the United States. The United States, we're a little dyslexic. In the northern part of the United States, we act like UK and Ireland. In the southern part of the United States, i.e. California, Texas, Arizona, Florida, we actually look a little bit more similar to Spain and a lot more like Mexico. So what you're looking at there is you'll see that we actually get a little bit of a gentle wave action going instead of that sharp change. And that's because of the fact that the season where we will see those flus and things like that is actually air conditioning season in Florida, Texas, and Arizona. But you'll notice what we've had a little bit of a climb in our death rate, but you'll also see that we've definitely just got a lot of cases going on. Now let's take it right here to home in Colorado, because we all really want to know what's happening right here. Why are we shutting down in Colorado? Well, the question is when you look here at the bottom one, you'll see that those are the bottom one there is our death rate, okay? The top one there is our cases. And you'll see that it didn't look like we had a lot of cases in the beginning, but we've got a lot of cases right now. This is concerning. We need to shut down, right? How much are we testing? We're testing a lot. So if you don't want to see so many cases, don't test so much. The reality of the situation is, the truth is you can only go by the death rate as to what the actual virility and threat this virus actually is. And when we look at the death rate, we see some really interesting things. First of all, May 9th, how many of you here realize that we actually changed the definition of cause of death here in Colorado? That occurred on May 9th. Before May 9th, the way the deaths were being recorded, and I don't know how it's impacting this data here exactly, I had trouble figuring that out from Worldometer. Before May 9th, if you died with COVID, it was listed as a COVID death. After May 9th, thanks to the wonderful work of our representative, Mark Baisley and others, it changed to being dying from COVID. That's a pretty significant change. You can have a positive test and die in a car accident. You didn't die of COVID. You died of a car accident. But it was still being listed as a COVID death, which will falsely inflate those numbers. The other piece that you see here is you'll see a question mark because there's a little spike right there. But what's interesting about that little spike? What's interesting about that little spike is that a couple of days before that little spike, it looks like there's virtually no cases, which means someone didn't report the data those couple of days, would be my suspicion. Can't say it for sure, but it's definitely not the start of a curve because it's just a spike. So from a data perspective, we throw that out. We just consider that an anomaly in the data. Now, as I'm saying this, any death is tragic. And by no means am I minimalizing that. However, what we're not looking at and what we're not counting is the number of deaths from suicide, from domestic violence, from drug overdose, alcohol overdose. The depression and the anxiety is going through the roof. And I think that when we take and we start looking retrospectively from this time, we're going to find we may have actually done this to ourselves. So what you're seeing is the PCR testing rates going up there, and that is dramatically increasing those numbers. You'll see that the death count actually dropped significantly. Testing, not so simple. How many here know what a PCR test is and feel like they could actually give a description of what a PCR test is? Yeah. PCR stands for polymerase chain reaction test, okay? It's a diagnostic test that is used to determine the fragments of genetic material that are coming from the virus. It's the equivalent of looking for car parts after a car accident on the freeway, and there could be car parts scheduled, thrown all over the freeway. And so because you see those car parts across the freeway, you're saying, wow, this must have been a really bad accident. This must be a real problem. And I need to watch out, this car is going to kill me. No, that's the past evidence of what already happened. It also just so happens that if you had the flu back in, say, September of 2019, you can still come up positive on this test from a common cold back in September 2019. I don't know about you, but I really don't want to be called a positive COVID test from the cold that I had back in September of 2019. So there's some real issues with accuracy of this test. It also just so happens that the individual who created this test, who bless his heart is deceased, specifically stated it was never intended to be used the way that we're using it. So we have some real concerns about what is a true positive, what's a false positive, and what type of action we should take. Certainly, we shouldn't be quarantining based upon the PCR test. The second test here, a little bit more reliable, antibodies testing. It's a serology blood test that detects whether or not you have developed antibodies. You'll see either IgM or IgG antibodies. The IgM will show up early on. IgG typically takes around 14 days to show up. We like to say, oh, you're immune now because you have antibodies. Or maybe you're not. We're now finding that we are actually seeing cases where people don't have antibodies and they're immune. We see cases where people have antibodies and they're not immune. I don't know if I want to count on that for testing. Who here recognizes this picture? This is a killer T cell. This is what I put on that first slide, that opening slide. Killer T cells, they rock. These guys are the true heroes of the day. What we are now finding is that some coronavirus patients who only suffered mild illness have a dramatic T cell response, and that T cell response is actually being a more accurate determinant of immunity. Fantastic. That's the test we should all go get, right? Except for one thing. It's not available here in the United States. So with all that, let's take a step back and look at lessons from history. This is from the swine flu of 2009, and it's an article that was done in Spiegel. And again, my compliments to Ivor Cummins for the fact that he presented this. And this article is fascinating. I'd encourage you to go out and look for it. The really neat part is each time you'll see that the internet search term is up there, so you can go search it for yourself. You don't have to worry about trying to copy down a URL link. What they found is that in the swine flu of 2009, that there was a massive vaccination campaign rolled out, and that it was anticipated to be a really deadly pandemic, and it actually turned out to be a fairly harmless strain of the flu. So why did the world overreact in that particular situation? Well, it's real easy to look at those things retrospectively. I think we're far enough into this one now that we may be able to take that same look and look at what happened from the 2009 scenario and make some better decisions. So let's look at some scenarios now with lockdowns or lack of lockdowns across the world. Most of you have heard of the Sweden situation. What you're seeing here is, and I'm sorry that it's kind of small, all these slides, by the way, will be on my website so that you can go in. It's going to be a free digital download. So just go ahead and go through the process. It doesn't cost anything. And just click on the digital download and you'll be able to get those slides. The orange curve that you're seeing there is the death anticipation level that we had based upon what the epidemiologists were predicting if we did nothing. The grayish curve that you see there is what we anticipated we were going to see if we took some moderate lockdowns. Anyone want to guess what that blue line is? Yeah, that's what Sweden was in reality, with no lockdowns. The estimation was 15 times higher. 15 times higher than what the actuality was. If anyone wants to learn more about lockdowns, and this is, I think, particularly critical for our elected officials who are in a very difficult position trying to figure out and discern the way ahead. There's numerous studies here that our elected officials can go look at. There's tinyurl.com/lockdown studies. Ivor Cummins has done some fantastic work and laid it all out according to the data. So please, please, please share this information with your elected officials because they are really in a rough spot. If you don't know, it's really hard to take those next steps, especially when everyone's like, someone's going to die because of you. None of us want to be on that end of a decision, do we? April 30th of 2020, World Health Organization praises Sweden as a model for other nations to follow. April 30th. It's October. Why are we locked down? You can look this up for yourself, but the World Health Organization official, Dr. Ryan, the Emergencies Program Executive Director, praised Sweden as a model for many other nations to follow. And you can go look up this article. It is available on the internet. I accessed it just yesterday. Well, maybe that was then. Things have changed. October 10th. World Health Organization urges world leaders to stop lockdowns. Do not use it as your primary virus control method. Okay? Dr. David Nabarro appealed to the world leaders, telling them to stop using lockdowns as your primary control method. The part that's really interesting is he said that the only thing that the lockdowns are achieving is poverty. we are possibly looking at one of the largest wealth transfers in at least the history of this country. And it's going on right now. Little bit more information. October 12th, World Health Organization epidemiologist encourages self-regulation. Here's the real key. He praised Sweden's approach for relying on the relationship with the citizens and on the citizens' ability and willingness to implement physical distancing and self-regulation. I believe that if we are to reach a new normal situation, Sweden can in many ways represent a model for the future. You are empowered to choose and do what works best for your family. And that is a perfect transition point for us to move into a little bit more of what we can actually be doing. Just to see what happens with lockdowns versus no lockdowns, what you're looking at here is all 50 of the United States. It's not something you're going to be able to distinguish out where Colorado is. It's in that big mush down there at the bottom. Ivor Cummins is the one who put this together. But the big dark blue line that you're seeing there along the top is Florida. You're looking at Florida's death rate. And then what happened is the governor brought in an epidemiologist. They took a really good look and said, wait a minute, are these lockdowns making sense or not? And so they stopped the lockdowns. And that was at the end of September, which is where you see that cut line. What you're seeing since that time now is Florida no longer under lockdown. And you're seeing that death rate. Okay? It didn't really make a difference, did it? Certainly not one at the level of justifying closing Florida down to tourism, which Florida is extremely dependent on. If Florida doesn't have its tourism, Florida probably doesn't make it. So with all that, scientists came together and put together what's called the Barrington Declaration. What's interesting is when you go to do a Google search for Barrington Declaration, you see all of these mainstream news pieces slamming the Barrington Declaration. Why can't we talk about it? What it actually is epidemiologists and public health scientists who have grave concerns about the damaging physical and mental health impacts of our current lockdown status. What they advocate is a focused protection. So in other words, the aged population, the population that has a lot of comorbidities, absolutely, let's take some precautions with that population. But let's not lock down the healthy. Let's not close the schools. Let's not destroy the social structures. Isolation is far more deadly. It is not the way we were intended to live. Keeping measures in place until a vaccine is available will cause irreparable damage, with the underprivileged disproportionately harmed. So with that, okay, fine, let's open up. But we all need to wear face masks, right? This is from 2016. And the reason why it's up here is because we really need to look at some of the science from before all of these mask mandates. We're running into situations currently where you really have to dig deep on the science and discern what is good science and what's bad science. You actually have to dig and figure out who funded the study. Did they have something to gain? And what's really bad now, and Ivor Cummins talks about this in his presentation on Pandemic Town Hall, there have been studies done. The answers didn't come up with what they were hoping they would come up with, and the research medical journals are refusing to publish the results. They're not brave enough. There's so much going on from a financial and a political standpoint that is impacting our health and our science arena at this point in time. And it's an entire different discussion, but you need to be aware. There's a lot more going on that meets the eye. what they basically figured out, according to this particular review, is that the face masks were not as effective as they claimed to be, and that it was an old dogma. Now, this one here is particularly interesting. I really like this study. It was actually done and posted by the CDC. There are 14 different randomized control trials that were done in this study. And what they found was that although mechanistic studies support the potential effect of hand hygiene or face masks, evidence from 14 randomized controlled studies of these measures did not support a substantial effect on transmission of laboratory-confirmed influenza. Let me break that down into common speak. Masks didn't stop transmission of the flu virus. Coronavirus is about the same size as an influenza virus. How much good is your mask doing you? Study that was just posted from August 24th. This one was actually done by the University of New South Wales. And what they found was that they had workers from 14 hospitals in the Vietnamese capital, Hanoi, split into 3 groups. Those who were wearing medical masks, okay, N95, properly worn, proper seal. Okay, this isn't just throw it on, throw it off, get your hands underneath it, scratch, none of that type of stuff, okay? This is properly worn masking, right? Really restricts oxygen over time. Some people were doing that. Some people were doing a cloth mask, and others were just doing what would have been considered normal mask wearing processes for like when you do a procedure, so you don't end up, inadvertently contaminating a sterile field, those types of things. Okay, just really trying to keep, the bulk of it back. What they found was the penetration of the cloth mass by particles was 97%. It's the equivalent of trying to keep a mosquito from going through a chain link fence. Now, here's the key. For those of you who are into the air sciences, and yes, I worked with all the OSHA folks quite closely for years and done a lot of environmental health work, I understand that there's electrically charged particles and that those get trapped and that sort of stuff. But this is pretty clear about particle size. 44% actually went through the medical grade masks. So medical grade mask is better, but still nowhere near where people really think it needs to be. Here's the really key point. Professor McIntyre said, masks are worn to protect from infection during pandemics and outbreaks, especially when there are no drugs or vaccines available for protection. Translation, it's your Hail Mary. So you can at least try to do something. Do we have good treatment modalities available to us now? Yes, we absolutely do. Now, if you are concerned about wearing something and you do have someone who has higher comorbidity rates and you're looking for something that actually has the science to show that it works, it's personal air ionizers, and they do work. They work quite well. They actually are effective against dust, mold spores, smoke, viruses, fumes, odors, and allergies. I knew about these because of working with all of my mycotoxin mold patients. They were extremely environmentally sensitive. They were able to, again, embrace doing air travel, things like that, based upon being able to use these personal air ionizers. It inactivates the coronavirus particles by generating ultraviolet light. It's basically like lightning in a little box. And so it creates an ionization, which then goes ahead and either destroys those particles or repels those particles from your breathing space, which is what you can see in the diagram there. You can find these air ionizers online. You can also find them on my website because they're a part of what I use for working with the population that I commonly work with. Go ahead and click on the little pop-up there that says, "Don't stress, be panda-proofed." Just hit download. It'll take you to the next step, which you can just add it to cart. It's free. Does not take your credit card or anything like that. I just have to have a way to get you to where you can actually get to the download.